Perfect. Hey, everybody. Thank you for joining us. Give it a minute or two for another set of folks to join. I think we're two after Kathleen, so maybe it makes sense to get started. We have a full lobby here, so I just want to thank everybody for joining us, and I'll pass it over to Kathleen to kick us off around, what we'll learn today, and thanks everybody for joining.
Thanks, Mel. Thanks, everyone, for joining today. It's lovely having you on a Thursday before a holiday weekend, so we really appreciate it. Welcome to the Nurse Retention Solution webinar. We're happy that you could join us. This is our August healthcare event for Microsoft. I'm Kathleen McGraw. I'm the Global Chief Nursing Information Officer at Microsoft. And along with me today, I'm joined by David Pratty, a Business Applications Director and registered nurse. Also with me are Melissa Nelly and Kyle Thompson, both technical specialists in our healthcare group. Before we get into the content, let me first set the agenda. Over the course of the next 40 minutes or so, we're going to share insights into the current challenges facing providers and nurses today and the impact that this has on your organization. We're going to explore the tangible benefits that Microsoft solutions can deliver and review a solution that we've built to help alleviate these challenges that you face in your workspace, in your healthcare workspace. I will say these solutions have been informed by our current customers that we work with, by healthcare organizations across the US and abroad. All of which are hoping that will help you increase nurse retention by supporting nurse competency, driving nurse efficiency, and increasing nurse wellness. But first, let me start by saying thank you for you all for being here today. We're actually excited to talk to you about this new offering that we've called Nurse Retention Solution. One of the trends that we've seen in the healthcare industry, and I know that you see it as well, is employee retention, which really drives a significant impact to the bottom line. And specifically in the provider space for healthcare organizations, nurse retention leads to budget issues and budget constraints. And as a result, it's hard for providers to be transformative and forward-looking because you're constantly under financial pressure or even under the pressure just to staff the units and keep the lights on and keep things moving for your patient care. We believe we have an answer to this challenge. It's the nurse retention solution. This solution is comprised of 3 different use cases that were born out of an executive forum where many of our key customers and our Microsoft subject matter experts met together, identified what problems were trying to be solved, and how could we help solve them with the solutions that we have at Microsoft. We believe the solution that we built will ease the burden the nurses are facing, and that potentially leads to nurse turnover and nurse burnout, which leads to significant financial burdens for organizations like yourselves. So moving on, as I mentioned, the Nurse Executive Forum just a minute ago, that was held back in October of 2023. It was a one-day session with many healthcare organizations, senior nurse leadership. It was chief nursing information officers and chief nursing officers. And I just want to take a moment to thank those nurse executives that participated. And if you're attending today, we appreciate you being here. These providers came together along with our Microsoft subject matter experts to talk about the issues that we're facing nurses today, the nurse workforce today, specifically what was causing issues around nurse retention and nurse turnover. And out of that came some significant insights into different issues, challenges, and use cases, and most importantly, what would drive satisfaction for your care providers. That information, along with additional research and conversation that we conducted ongoing, is the foundation of the solutions that you'll see today. So this solution has been developed through direct end user feedback. And there are 3 core areas that we focus on: competency, efficiency, and wellness and recognition. So as I mentioned before, nurses are overwhelmed. We talk about the current situation just in a little bit of detail here. We know providers are facing tremendous challenges, both financially as well as workforce challenges. The significant financial challenges that are preventing you from looking at the future and transforming the way that you need it to. It's been reported that almost 2/3 of all nurses report symptoms of burnout. And one of the most compelling statistics is that nurse turnover is at a rate of almost 23%. That's the national average. It might be a little lower where you are geographically, or it could be a little bit higher. And for every nurse that leaves their job, it costs the hospital between $40,000 to $60,000 to acquire and onboard every new nurse that they're bringing in. So when we start extrapolating the numbers, the impact is significant. The nurse retention solution isn't going to solve nursing turnover. It's a very complex issue. But we can take these three core areas of competency, efficiency, and wellness and recognition that the nurse executives are prioritizing and make an impact there. Our belief is we can lower that 23% by at least a couple of percentage points, which then drives for an organizational return on investment for you so that you can also help your nurses and your organization. So moving on without further delay, I'd like to introduce the nurse retention solution, which in addition to a great financial return on investment can also help you realize operational outcomes as well. So today we're going to show you three use cases that I mentioned: nurse competency, nurse efficiency, and nurse wellness and recognition, which when applied to your organization will really help increase nurse job satisfaction, improve patient outcomes, and reduce cost, all of which will reduce nurse turnover. Let's dive a little bit deeper into each of the use cases, starting with competency. So I'm going to hand it over to David.
Thanks, Kathleen. As Kathleen mentioned, one of our nurse retention solutions focuses on competency. The problems providers face today are around nurses getting up to speed with training, whether they are a new nurse, change units, or just coming through a regular orientation pattern. Providers are incurring overtime costs, losing nurses to other providers, and making mistakes too, as well as they are hurried during their daily delivery. Nurses need to have tools to interact easily at their fingertips and notifications. If you think about a single pane of glass where everything is coming in, that's what is needed. Now let's take a look on how this would play out. Next slide. So our persona here is Karen. She is a nurse. She receives an alert on her upcoming training that requires registration. She uses this nurse competency dashboard to view all of her training requirements. That's a very important piece, right? So she's not going different places to see what training she has to do. She's seeing everything from one view, basically. She views her dashboard and can see her competency metrics and view on-demand training content. She registers for her safety and wellness course directly within her dashboard. Then at the same time, a week later, she sees that she's now signed up for that particular class. And within the same dashboard, she comes across a patient that is exhibiting sepsis behavior. So she looks at her sepsis protocol through a virtual assistant and pulls up the hospital protocol around sepsis to further refresh her memory of what she needs to do in this particular case. With that, I'm going to pass over to Melissa to kind of go through a demo and show you this in live demo. Thank you.
Great. Thank you so much, David and Kathleen. Really appreciate you guys walking us through kind of how this solution really came about. And so what we're looking at today is the first piece that David mentioned of our solution called the Nurse Competency Dashboard. And when I think about nurse competency in this dashboard here, as I log in as our main nurse here, we're talking about Karen. She's new to a hospital. She's been here for about a month or so. This dashboard is really going to be her centralized location to learn about her job, to learn about her patients, and to learn about her wellness. You can see from the navigation pane, all of this information is available here on the left-hand side. I have access to those core areas of competency, efficiency, and patients, and our wellness dashboard as well. Now, as Kathleen mentioned, this was really built in conjunction with nurses at that co-innovation session. So we're going to be showing you a plethora of different areas today, or different dashboards that we built based on all of the information we did gather based on what we heard nurses really wanted. That being said, based on roles and responsibilities, while we are going to take a look at these three areas today, you can always turn on and off these pieces of the solution as needed based on roles and responsibilities. So again, as I take a look at the nurse competency dashboard, I'm here as Karen. I'm within my first month at the hospital. The first thing I notice already is a proactive alert. I'm being notified that I have a required safety and training coming up and that I need to register for this required training course. These proactive notifications are tailored to me specifically as Karen. So again, as I log in, I'm getting these active notifications letting me know that based on where I am in my training, what trainings I do have coming up. The benefit of this centralized dashboard is that I can actually go ahead and register for that course right within this dashboard. So you can see I have this drop down here. I do need to register for that nurse wellness course. I can go ahead and register for any additional upcoming courses that I might have. I also have access to upcoming courses and then my required courses that I do have, those trainings that are coming up. So again, just providing that centralized location. So as Karen, as I'm new to the hospital, I don't have to log into other solutions or other sources of data. I can go ahead and register for those courses right here within one platform and get those proactive notifications letting me know that those trainings are coming up. In addition to be able to register for those trainings, I can view content, videos on demand here within the same screen in which I went ahead and registered. These videos and these learning modules and content here are dynamic, so they are specifically tailored to the user who logged in. So Karen, being a new nurse, maybe she has a little bit longer, more informative videos versus some of her tenured peers that have been here a while. Maybe those videos differ based on individual users. That is something that we can configure dynamically based on those individual users. As I move over within the dashboard, you'll see here that I have a couple of metrics and analytics based on my day-to-day. As mentioned, from a training perspective, I can see my actual training hours that I've completed versus predicted hours that I do have coming up, allowing me to potentially allot some time in my work schedule during the week so that I can prepare to take those trainings. But I also have some trends on how well I'm doing in terms of patient focus. So maybe how much time am I spending with patients? How much time am I spending on things like documentation? So am I spending way too much time, less time with patients and more time working on patient documentation and not necessarily using document automation? I can see those metrics. And then lastly, we'll dive deeper in our wellness section, but I can see that I'm starting to kind of trend in the red here as far as wellness time is concerned. This could be based on data and analytics that we're capturing as far as things like PTO and time off are concerned. We'll walk through a little bit later how within the same tool, Karen can go ahead and request that time off or request that ship coverage. I'm just going to pause here really quickly before we take a look at our nurse virtual assistant and ask Kathleen here, as the nurse co-innovation session was happening, how important was it for those nurses to have kind of that personalized, dynamic, individualized dashboard here for them in their day-to-day job?
Yes, thanks for asking, Mel. So the North Star vision really was a nursing competency co-pilot that delivers just-in-time, contextual, and individualized coaching for nurses throughout their career journey. So I know we call this both competency / onboarding, but there really was seen a need that ongoing nurses wanted to grow their career journey. So this would offer them an opportunity to do that. And ultimately, the goal is to create more competent and effective nurses.
Amazing. Thank you for that. I think what we're able to accomplish here on the left-hand side really helps to lend itself to creating that personalized dashboard. But on top of what you said around creating sort of that co-pilot, on the right-hand side, as David mentioned, as I'm new to the hospital, I might have a query, I might have a question as I'm working with patients or I'm on the hospital floor. Maybe I have a patient that's presenting with sepsis. Maybe they have a fever. At any point to your response around, can we have a co-pilot, something to really help us answer these questions in real time? I can actually connect my nurse virtual assistant to knowledge-based articles within the hospital. And I can go ahead and ask it, can you actually outline the sepsis protocols for me and next steps if I am with a patient? Now, what our nurse virtual assistant is going to do is it's actually going to pull all of the data that it has from our knowledge bases within the hospital library, and it's going to give me a succinct and concise summary. I can go ahead and get all of the information from those documents if I need to. It's pointing me to the citations where it found this information. I can go ahead and open up that individual library and pull that information in. But what this is enabling me to do is get information and knowledge real time as I'm moving about the hospital. This nurse virtual assistant, again, can go ahead and be connected to that knowledge-based source and provide answers around multiple questions that I might have, but it could also be deployed across various solutions. So we are using it in the context here of our nurse competency dashboard, but if we did want to deploy this nurse virtual assistant somewhere else, maybe in another tool set within the hospital, we can go ahead and do that as well. So what I was able to see here as Karen in my first month in the hospital, I received this proactive notification letting me know that I did need to sign up for some outstanding courses. I was then able to actually sign up for that course in the same centralized dashboard, kind of decreasing that burden of having to jump into other solutions. I was able to view dynamic content that was tailored to me right within the same tool as well. And then lastly, on the right-hand side, kind of using metrics and analytics, I was able to see how well I was doing in terms of patient focus, patient documentation and wellness time. And then lastly, I was able to use that nurse virtual assistant so that I can get the information that I need in the context in which I need it if I'm working with patients that day. I'm going to hand it back over to David now, who's going to actually walk us through our next scenario. Give David a second here to come off of mute.
Sorry about that. My internet went down. So the
No
next,
worries.
yeah, it's always going to happen during that
Always happens.
live performance, right? So the next module we're going to talk about our app is care team efficiency, right? So according to the Joint Commission on Improving Patient Safety, ineffective communication among healthcare professionals contributes to medical errors and patient harm. Nurses in healthcare settings often struggle to manage numerous communication channels, stakeholders, inputs, and systems while caring for multiple patients. As we know, as nurses, the nurses on the line, and other healthcare workers who've been in a hospital or any kind of hospital experience, a lot of times the nurses who you associate with the most often during your particular stay. When you wake up in the morning, you open your eyes, the nurse is usually there for their daily rounds, their morning rounds. And a lot of people don't understand, this is the first person I saw, so I'm going to relay any information to this particular person. So it may be a lot of non-clinical things, right? So, but we always take that in. I remember, back when I was working in the hospitals and stuff, I'm surprised I didn't have ink poisoning because I always would write everything down on my arms and my hands and everything like that. So this particular system, what it will do is our solution, it'll put everything into one place. You'll have a communication hub, if you will. So what this will do, a lot of times the nurse gets behind in their daily routine, and this will lead to after hour charting time and less time with patients, family, and friends. So this nurse retention solution will provide a single pane of glass. I know I keep saying that, but we want to put the picture in that this is one solution, right? They're not going multiple places. So it's going to have the single pane of glass for everything from a room's blind is broken where a nurse can open a help desk customer service solution ticket to get maintenance to a last second dietary change order right before the trays hit the floor. Now let's look at this scenario. So Karen again is clocking in for a shift and quickly connects to the nursing efficiency portal built to assess and prioritize follow-ups. On her rounds, a newly admitted patient has a low O2 sat level. Karen updates the respiratory therapist team on the patient's needs in the portal. Keep in mind here, we are sending the request to the respiratory therapist. We're not documenting kind of O2 sat levels or anything like that. We know that will be done via the EHR. Karen reaches out to the therapist team directly to ensure the patient needs will be met. She is now enabled to attend to nurse patients' needs promptly and advocate for them. And we'll show you how that carries out in a demo. I'll hand it over to you, Melissa.
Perfect. Thanks so much, David. So jumping back into our solution, again, as Karen here, I'm starting my day, went through my trainings. But as I start my day and I make my rounds, I'm going to want to have access to take a look at my patients and those requests that they have. As Karen, I know she's really hyper-focused on patients and their outcomes. She has the ability to take a look at these various dashboards here. Same as with the nurse competency dashboard, pieces and components of this dashboard are completely configurable and they're tailored toward Karen and the patients that she's been working with. So I do have access to my different dashboards here. This is drag and drop and configurable, and I could also drill down further into a lot of these metrics as well, which we'll see in a minute here. But I can see patient by status. So this is how patients are being what their status is across the hospital. This could be based on how often they're pressing the nurse call button. This could be based on data and metrics that we're collecting from the EMR so that we can go ahead and label those patients from, bad, good, neutral to severe. So as Karen is able to start her day, she does have access to see, which patient is doing the best and which one might need her care the most immediately. She can also see the active reasons in which they were admitted. So again, kind of qualifying who might need her help first. And then I can also see active and outstanding requests. And as David mentioned, those requests can be things like diet, maintenance. Maybe someone from a previous shift had an outstanding shift request for me specifically. I could go ahead and pick up those requests. But again, as Karen, I'm hyper focused on my patients and their outcomes. So I am going to dive a little bit deeper into my patient dashboard here. And again, I mentioned earlier, you can actually continue to drill down into this. So I am going to pick my most severe patients. Again, that is where I want to start my day. And I can see, again, according to this color coding here, that Kathy Carson is really the most severe. And I should probably go ahead and address Kathy first. So let's open up Kathy's patient record here. So as Karen, I have direct access to Kathy's patient record. We could be pulling in this information from other data sources like our EMR. I can see that she also has some notifications on the right-hand side as well, and a maintenance request. So again, as Karen, I don't really have to leave this centralized dashboard as I look to treat patients in real time. I have access to Kathy's direct patient record. I can see that she has 2 outstanding requests. The blinds are broken in her room and she feels like she's unable to get some sleep. And she has a full meal request. So she is on a full meal, but she's a little bit perturbed. She only got a liquid breakfast and lunch. So I do have those open requests here. And then thankfully, again, because I'm in one centralized dashboard, I was able to see that the broken blinds request, that has already actually been scheduled and assigned to somebody else. So again, I don't have to jump into another solution. I can see things like diet request, other information from nurses who were on a shift prior to me. I get that all within my centralized patient record here. I do have access to that nurse virtual assistant that I was alluding to a little bit earlier in the context of Kathy and caring for Kathy as well. So again, anywhere within the platform, if I want to ask that nurse virtual assistant a question, I do have the access to do so. Now, because I'm looking at Kathy and she is the most severe, as Karen, I might want to wheel my cart into her room and just check her vitals. And as David mentioned, if we notice that Kathy maybe has some low O2 sat levels, and that's a bit concerning to me, again, within the same dashboard, I can go ahead and create that request and pull in somebody from the respiratory team. So again, as I'm working with Kathy, I can pull in the specific department that I'm working with. These drop downs are completely configurable based on the departments that I work with. And automatically I can see it's actually giving me Kathy's room number. So it knows that I'm working with Kathy based on her patient record. It's got an update about what room she's sitting in. And then I can also provide that update here as well. So I can say I need some respiratory support. I can provide a status reason. This is brand new. And I'm going to make this a high request. Obviously, I'm a little bit nervous about Kathy right now, and she does have some outstanding requests. I can go ahead and create that, and you'll see it'll automatically populate here on the patient record. So as I finish my shift, if somebody does pick up my shift, they will have access to Kathy's full patient record. They can see any outstanding requests as well. Now, when it comes to communication within the platform, very similar to the nurse competency dashboard, I received this notification, this reminder that those requests are in progress, they've been assigned. But also in creating that respiratory support request, I can see down here that a text message actually went out to the respiratory therapist team and asked them to make sure that they see Kathy ASAP in a timely fashion and gave her information around her room status as well. Another way in which I might want to engage with the team as time passes by, if Kathy's still not being addressed by the respiratory team and I'm getting a little bit nervous as time passes, maybe I get a notification that tells me that, Kathy still hasn't been seen. So a text message went out, a couple of days might have gone by, and the respiratory team still has not seen Kathy. The tool is letting me know that this is an urgent request. It's still on her patient profile, and I haven't cleared it. I haven't changed the status. I haven't said, this is in progress. It hasn't been assigned to anybody. The tool is proactively providing those notifications so that I can ensure that Kathy gets the best care possible. But again, another way in which we can communicate with that respiratory team, anytime within the solution, I do have access to my Teams channel. So you can see we are on a Teams meeting right now, right? So you can infuse Teams within your dashboard here so that you could go ahead and message that respiratory team. And I can say, hey team, Kathy does need some help here. What's the plan for getting her that help? And this can all happen within real time. You can see the respiratory team has already responded. They said, sorry, they've been a little bit busy, but they'll get on it right away. I'm just going to pause here really quickly and ask Kathleen, we've saw a couple of methods of communication here. So we've seen being able to chat over Teams. We've seen some text messages going out. We've seen proactive notifications. How important is the communication aspect was that during the nurse co-innovation session?
Yeah, thanks for asking, Mel. So the nurse leaders actually brought up the Joint Commission, saying that ineffective communications among healthcare professionals is one of the leading causes of medical errors and patient harm. So I'll repeat that. David had mentioned it as well. We know that nurses are at the center of all communication. There could be multiple communication channels, stakeholders, inputs, and systems. So it's very easy for them to become overwhelmed as they're trying to take care of many patients most times. So the ability to have a collaborative communication and care coordination platform, and that's really designed for care teams, is really valuable for them. So care team members have direct access to resolutions, information gets to the right person, the right time, and right away with less interruptions to nursing care, and you have better patient outcomes. That example that you gave of the broken blinds was the example that the nurse executives gave, right? Because nurses are responsible for everything. A nurse won't necessarily fix those blinds, but the patient will tell the nurse about that, and that happens multiple times a day for many things.
Yeah, thank you. And I think, the main purpose of this dashboard and of having all this information available on the patient record is to give our nurses the comfort of knowing sort of the status of these active requests so that when they do interface with the patient, they're able to have an answer, right? And let them know that this has been assigned, we're here for you. We are working on taking care of you, and someone will come into the room and help fix those requests. And then it can also kind of just help them to track where some of these other requests are as well, without having to jump again from different platforms. It's all centralized into one single pane of glass here. So what we were really able to see in this scenario, when we take a look at our patients and our nurse efficiency, as Karen, again, I was able to come into the tool and take a look at my most severe patients and address those that needed my help most immediately. I was able to work with Kathy and see all of that information consolidated on her patient profile. And then from there, from her patient profile, I was able to continue to submit requests on her behalf and then communicate downstream with the other teams that I'm working with. So again, messaging that respiratory team, sending those alerts out, messaging them on Teams, or even sending them a text message. I was able to do that from all one consolidated platform. And again, in the context of the patient record of Kathy. I'm going to turn it back over to David and the team, who are going to run us through our last solution, which is wellness.
Thanks, Mel. So as Mel said, we're going to go into the wellness application. Before I do that, I'm sure everybody on the line is kind of thinking how this works, or how this would work where they're at in their healthcare setting. I do want to make the comment that you don't have to start with all three, right? So if you wanted to start with one of these solutions, build the other two, or maybe you have something for care team communication, don't really need that, maybe need wellness in the first piece, that's fine. Okay, so you don't have to, this is not an all-in-one solution. So you can start small and then build if you need to. So as we dive into the wellness, in the healthcare sector, nurses are facing heightened levels of burnout and frustration. I think we've talked about that, particularly due to the challenges brought about by the pandemic. They are frequently overburdened with tasks that go beyond their job descriptions. We've touched on that today, often without receiving the recognition they deserve. Through this solution, we have developed a scenario that prioritizes wellness and recognition to improve the work experience of care teams. Nurse retention solutions can integrate and enhance existing HR tools with wellness metrics and career development portals, promoting role fluidity among employees. These initiatives not only enhance the well-being of care teams, but also have the potential to reduce the cost of care while improving the quality and outcomes of patient care. Let's walk through the user story in the next slide. Okay, so now we're going to switch up a little bit. Where Karen, finds a renewed purpose with the wellness solution. Her manager, Amir, is her supervisor, is responsible for finding savings in his department, and he's focused on reducing turnover by ensuring his nurses receive recognition and ample PTO. Amir notifies Karen that she's overdue to take PTO after his app notifies him that she's gone X amount of days. I mean, we have 45 days here, but X amount of days, you set that particular notification as you want to see that notification, right? Come across. Karen uses the app to request time off and get her shifts covered. Very important part here. So she's going to request time off. And when she does request time off, it's going to send that to Amir, but also too, it's going to have suggestions for Amir to fill that particular gap in the schedule with existing nurses. It may cut out the travel nurse and things like that. Somebody who's actually submitted to say, hey, I'd like to work on Wednesday at 7 p.m., the 7 p.m. shift if it comes up, right? So while she's in the app, she also gives the shout out to a fellow nurse. So we have a kudos in here. So say, for instance, John, the nurse on the floor, comes and starts an IV for me one morning, really early in the morning. I'm tired. I just feel like, this patient's got thready veins. I don't think I'm going to be able to start this IV. So I call on John. He gets it first fix. So this allows me to actually put in the app. Kudos to John. But what's really important here too is everybody's using this nurse solution. Everybody sees that John, did this. It's not just kind of a floor or unit situation, right? So he receives kudos across all of the hospital organization, which I guess could be good and bad because if you think about it, then everybody's going to be calling John to start IVs. But Karen loves the recognition and the push to time off she's getting. And at her new hospital, starts to think about her future career opportunities. So a lot of times, nurses will start somewhere and they want to go up to an ER, ICU, or something else. This particular application is going to give them that actual training, what training they may need to take, and also some mentoring selection so they can mentor with somebody who's already in those particular positions. So let's go ahead and take a look. I'm going to pass it over to Kyle to go ahead and take a look at how this will look in a demo.
All right, thank you, David. So you're going to see my picture on the screen moving around with a mouse cursor. That's just me taking control of Melissa's desktop to run through the demo. All right, so let's take a look at the nurse supervisor dashboard. This is where Amir is going to log in and see a lot of different information on the screen as it pertains to the nurses and possibly, patient issues and so forth. One thing he's going to see is a sentiment rating. This could be coming in through surveys that are sent out periodically to the nurses, as well as nurse survey responses. Now, this is an example of a word cloud that is basically highlighting various words and phrases that are coming back as feedback through the surveys. On the bottom here, you can start to assign shift coverage if necessary, and then other information like nurse PTO and utilization, highest unused PTO, making sure that nurses are taking time off to rejuvenate, as well as the ability to look at extra shift requests coming in, as well as shift switch requests that are coming in from the nurses as well. One of the things that Amir can do is start to interact with this dashboard and maybe sort by issues that are being surfaced by severity. Right here, I can surface by high severity, and I can see information around those patient issues. And if necessary, I can escalate this and take a more proactive approach as needed. Now, one thing that Amir notices here is that there is a notification that came in saying that Karen hasn't taken PTO in several months. And at the same time, a notification is sent out to Karen reminding her to take some PTO or some time off. So I'm going to pause there just a minute and just mention that, this is an example of a nurse supervisor dashboard, and it can be tailored to your organization's needs, right? So the idea here is to kind of create a centralized interface where Amir, in this case, can come in and get an overarching view of what's happening with his team, as well as, if necessary, take proactive approaches in reassigning shifts or reviewing various issues, whether it's patient issues or maintenance issues that are happening on the floor, and escalate those as needed. Okay, so what we're going to do now is actually, before we pivot into the wellness dashboard for Karen, Kathleen, you mind if I ask you a quick question?
No, go for it.
All right. So the executive form that you led, how important was it to give, the emirs of the world, the managers and supervisors access to nurse health and wellness information like you're seeing here?
Yeah, I'm glad you brought that up, Kyle, and I'm glad you mentioned that. So it's not just nurse supervisor, it could be a manager, it could be a clinical leader, it could be a director. The fact is nurses are burnt out, they're frustrated, they're overworked, and they're underappreciated. They do things that aren't in their job description. They may not be recognized, and they're not really confident about their personal or professional growth patterns. So they get frustrated that they don't have the role fluidity, which Dave alluded to. Nurses would like to maybe move from unit to unit or whatnot to gain more experience. Maybe not. It just depends on how they want to grow. So really, ultimately, the North Star is how do we empower our nurses to take control of their work-life balance as well as their careers. So this really helps by envisioning the future that you get joy and balance back to your nurses so they can thrive. So this is considered of extreme importance to the nurse executives. They really envision this future of nursing where nurses actually are fulfilled and they can eliminate things or reduce the burnout and increase the longevity in the profession, which improves patient care and ultimately will drive value within their organization. So it's better for them to retain nurses, especially if they have good clinical providers at the bedside. So ultimately that means that they need to look at their well-being and they don't necessarily have the view into it today like they would want to have.
Hey, thanks so much, Kathleen. All right, so now let's pivot over to Karen's wellness dashboard. And inside this dashboard, actually, you'll notice right now, Karen just received that notification that came in saying, hey, you need to schedule a vacation day. It's been several months since you took some time off. So she can actually fulfill that inside of this dashboard here. But before we do that, there's a few things in here that Karen can review. Vacation day usage, for example. Also, maybe kudos or appreciation that's coming in from her coworkers or supervisor and other managers. She can log feedback, and then she can also see her shift calendar right inside of here as well. Now, this shift calendar, you can manage shifts within this solution, and you can also hook into third-party scheduling systems. So if your organization is using third-party vendors for that, we can integrate into those as well. Now, in regards to the PTO piece, she can log new vacation or PTO requests inside of here. Throw in the start date and end date. And we'll just do it for Saturday. And it's not approved. Like this is all open right now, but essentially what will happen is it'll automatically calculate the number of hours, and it will also shoot a message over to Amir so that he can either approve or deny that, and message back to Karen. So after Karen logged some vacation, she scrolls down and she reviews some of the appreciation that she received from coworkers. But this reminds her that earlier in the day, her coworker Justin helped her out with a patient, and so she can come inside of here and maybe send some kudos to Justin. So she can select who she wants to send it to, and then it says the feedback's coming from Karen, and we'll just do a quick thank you message, a misspelled thank you message, and that is going to instantly be routed to both Justin as well as Amir, so that or Justin's manager, it could be Amir or someone else, so they can see that feedback coming in. Additionally, she wants to log some feedback. So recently it's been really hard to find clean IV polls. And so she wants to service that up to management. And we'll just say clean IV polls, hard to find. And she'll save and close that. Now what's going to happen there is that that message will go directly to her manager or supervisor, and then Amir can escalate that. So if it's something that he can handle, then he will, or he can maybe needs to be escalated to HR or some other department to fulfill that request or look at that feedback. Okay, so now it's a couple weeks later, and Karen recently heard about a new training program. So there's a 90-day cross-train program where she can actually go in and look at, check out another position in the organization. And she did recently hear about an emergency room nurse position that she can cross-train with. So she can come in and learn more about the position, who's the hiring manager, what are the responsibilities and qualifications. Now, this is a cross-train program, but it does say that, hey, if you really like this position, these are the requirements to kind of move into that position and the qualification. So she may want to get a head start on doing some of those things. So she reads through it, she's interested, and then she clicks the Apply Now button. So something to highlight here is that we can integrate with third-party systems. I mean, if you're using like an applicant tracking system, or if you're using our platform as an applicant tracking system, you can, but you can also hook into other systems like Workday and others that will manage that for you as well. Okay, so what we're going to do now is that's a little bit about the wellness dashboard, and again, this can be tailored based on your requirements. So you may see some things in there you don't want, or you want to add additional data points and surface that to Karen, or additional functionality. You can go ahead and do that. Melissa, can we switch over to the PowerPoint?
Definitely.
Thank you.
Yep.
Okay, so we're just going to review what you saw here. So overall, it was an example of how the Microsoft technology can support nursing teams around, including management, around things like competency, efficiency, wellness, and recognition. And we iterate on this solution, right? We, like Kathleen said, this kind of idea, this kind of art of the possible came out of the executive forum that she led, and we are iterating on that and working with our customers to really tailor it to their specific needs. So if you want to learn more about different Microsoft technologies that revolve around what we call the Power Platform, we do have a user group called PowerHug, and PowerHug is essentially a user group focused around Power Platform and also some cross solutions or cross technologies at Microsoft, and it's really focused on the health life sciences vertical. And essentially, it's designed for administrators, makers, users, leadership teams to kind of come together and learn from each other. So we meet every fourth Thursday of the month to cover a variety of Power Platform topics. And we also often have customers come in and present their successes with Power Platform. So if you want to join, you can go to aka.ms/powerhug. We'd love to see you there. And you can physically join, and then you can join us virtually for these sessions, and you can participate in group conversations and ask questions to the forum and so forth. All right, so just one last thing, and I really do appreciate everyone taking the time out of their busy day to come and learn more about this solution. We have a digital sales team that's going to follow up with you. Oh, there we go. There they are. Joey and Alex. So they're going to reach back out to you via email. And if you want to reach out to them too, if you want to be proactive about it, their email addresses are on the screen, and feel free to do so. And yeah, again, I just want to thank you for joining us today. And that's going to be the webinar on the nurse retention solution. So have a great rest of your day.
Thanks everybody for the time.
Thanks everyone. Have a great day. Appreciate your time.